Okay, so now I'm going to perform trach care, and I would have done this immediately after performing the suctioning, or, if I would have just came into the room to do it, as needed if you needed it done. But first I would come into the room, I would introduce myself, maintain privacy, I would identify the patient with 2 identifiers, name, date of birth, armband. I would go perform proper hand hygiene. I would then put on some regular gloves. I would assess the patient, see how he's doing. I would go ahead and listen to his breath sounds again if I had not just performed suctioning. I would also explain to the patient, let him know exactly what I'm doing. I would then put on some protective eyewear because I don't want anything flying in my face while I'm performing the cleaning. I would place a towel over him to keep him dry. If I'm not getting dirty, I would remove the old gauze that is underneath the trach at the moment. Dispose of that. I would raise the bed to a height that is good for me to perform the trach care. I would also hyperoxygenate him if he needed it. Then I would also make sure I have my trach care kit, some scissors, my normal saline, and I would also have some hydrogen peroxide. I would double check to make sure the normal saline and the hydrogen peroxide were not expired, and I would also go ahead and unscrew tops and have that ready. And then I would also go ahead and remove the top of my trach care kit while still maintaining sterile field. Throw that away. I would then remove my regular gloves and put on my sterile gloves. So I carefully have to go in there without touching sterile field. And keeping my gloves sterile as well. Gloves in here are hard, so that's something I'll have to work on. And get my other glove. Maintaining sterile field. Maintaining sterile gloves. Okay, so now I would get the padding that is in there, open it up, shiny side down, and I'm going to use this to lay out all my stuff on that's sterile. So, got my pipe cleaner. That's stuck. Get that out. That is, and I would not be crossing over at all during this time. Not crossing over. Okay. So now I'm about to make my non-dominant hand unsterile. I'm going to remove the cap off of the normal saline with the top of it up. I'm going to keep the label up. I'll pour some in the big one, and I'll pour some in each little one, the normal saline, without it splashing everywhere. Now I would have my hydrogen peroxide, and I would do the same thing, and I would pour the hydrogen peroxide in the big one to where it would be half normal saline and half hydrogen peroxide. So I'm done with this. Now with my dominant hand, I would go ahead and I would place the brush in there and Q-tips in there. Have that ready for when I need them. So now I'm going to go ahead and I'm going to remove the tubing. I'm going to make sure, see how the patient's doing. As I'm doing it, make sure he's okay. I'm going to go ahead and drop it in the mix of the normal saline and the hydrogen peroxide. Let it sit for a second. Then I would go ahead and I would scrub the inside, get out all that nastiness that's in there. All nice and clean. And I would go ahead and put it in one of the normal salines to rinse it off and to get the hydrogen peroxide off of there. Make sure it's all nice and clean. Swish, swish, swish. And then I would use the pipe cleaners, one at a time. I'd fold it in half to dry out the inside. I'd be disposing of all of this properly at the same time. So once it's nice and dry, which I've got gauze too, yeah, dry it off. Once it's nice and dry, I would insert it back into the patient's drink. Make sure it gets in and make sure that it clicks. Next, I would get the Q-tip that is just normal saline to clean the skin that is underneath the trach. I would not use hydrogen peroxide because it could irritate the skin, and I would start from top to bottom because, you know, gravity is going to pull all the nastiness, it's going to drip down. And then I'm going to get the other Q-tip that would have hydrogen peroxide on it to clean the plate, because it's okay to use the hydrogen peroxide to get all that might be caked on there off of that. Next, I would dry it off like so. Make sure it's all clean, everything, all the nastiness is off. Then I would grab my new, without reaching over all the sterile field, my new tie, fold part of it, one of the sides in half, cut a hole in it, and I would keep the old tie on until I have put on the new tie. And so I push down the old tie, start attaching that new tie. So this awesome knot thing that we were taught. And I would make sure that lays flat and it's not twisted all around him. Tie it to the other side. Knot. Make sure it's all nice and flat. Go ahead and tie it. Make sure that it is not too loose, but that you can fit 2 finger lengths and 2 fingers underneath it, so it's not too tight either. Cut off the extra, and then I could cut off the old ones. Like so. Get rid of all that. I would have also put this new gauze underneath his trach so it can catch all that nastiness and be comfortable for him. I would clean everything up, get rid of the towel, dispose of everything properly. I would make sure and assess the patient, see how he's doing afterwards. I would lower the bed all the way. I would make sure the call light is next to him, and I would go document what I did. And I am finished.